Throughout the course of this pandemic, we could easily be misguided into thinking we are fighting all alone, fighting to simply keep our heads above water during this time. But the truth is, we're not alone. Hello and welcome to On the Record. I'm your host, Jerome Sawyer. In his presentation this Wednesday, Prime Minister Minnis expressed that our hospitals are full. The medical teams have been pushed to full capacity in New Providence, and that means the return of certain restrictions. And while Bahamians are split on the matter, we are certainly not alone. The United Kingdom, Jordan, Israel, Jamaica, Barbados, and Trinidad and Tobago are just some of the many countries that have had to re-implement lockdowns and tighter restrictions due to a spike in the cases or to mitigate against another wave. Tonight, we talk with our sister island nations in the region as we discuss the world versus COVID. Stay tuned, our conversation begins on the other side of this break. So the project really pays itself.
Correct.
They set up
at the conference, the school.
As a journalist, I always have to focus on the facts, and sometimes that means going to investigate for myself. On the Record, Thursdays at 8 p.m. right here on RTV.
You're watching On the Record. We're so glad you could join us. Tonight's episode of On the Record, we're discussing the world versus COVID and speaking with other Caribbean countries on the challenges they too are facing. On March 12, Trinidad and Tobago recorded its first case of novel coronavirus known as COVID-19. It was a 52-year-old man who had recently traveled to Switzerland. By the next day, there was another confirmed case, and within 2 weeks, they had already confirmed 49 cases and 2 deaths. Today, Trinidad and Tobago, a country of 1.4 million people, has recorded almost 5,000 confirmed cases, of which roughly 1,800 are active, and they have a death toll of 84. My guest for this segment of the show has been in journalism for over 3 years and following the COVID-19 developments since January. He is currently employed by Guardian Media Limited as a multimedia journalist. I want to welcome to our show this evening Mr. Rishard Khan. Rishard, welcome from Trinidad. Thank you so much for joining us. I want to talk first about the context. What has it been like for the people of Trinidad since your first case in March?
Oh, well, thank you for having me, Jerome. Okay, so in Trinidad and Tobago, it's been a bit of a worrying situation, especially of recently. So just to establish some context for our COVID-19 journey locally here in Trinidad and Tobago, we now have had 2 phases of infection. The first phase, which began on March 12th, as you said, ended around April because there was a lull in cases. We weren't experiencing any cases for about 80 days, and then on July 20th, with case 139, our second phase is marked to have begun. Now, it's important for us to know that the first phase of infections locally was mainly imported cases because almost immediately after we had our first case, about 10 days later, our borders were closed. We weren't allowing even our own nationals to return to the country without an exemption. Now, this is important because that back then it was imported cases. Now we're at a stage of community transmission. The virus is out there within our community, and people have understandably begun to get more worried. You know, it's out there. Persons are trying to stay home as they should be, and the measures, we've had a wealth of measures implemented to restrict the spread of COVID-19 by restricting our movement, restricting the opening of certain businesses. And it has taken a bit of a toll on citizens. We have citizens, we're a party-loving country where we're all about hanging out, as I'm sure you all would know in the Bahamas there, because we have the carnival and all the carnival events. So it's a bit of a shift for us to be staying at home and not out there with our friends, family, colleagues.
Now, for many Bahamians, the idea of living with these restrictions has been an area of contention. Explain to us what's happened with your restrictions, what kinds of restrictions have been put in place, and what has been the public's response to those restrictions?
Okay, so the restrictions has been updated very frequently over here in Trinidad and Tobago. And just to give your viewers an idea, I have here with me a printout of all the different restrictions which would have been implemented since March over here in Trinidad and Tobago. So it's quite a thick document. As you can see, it's about 28 different ones. So within our legal framework, we haven't or did not go the route of state of emergencies, meaning the entire country is locked down and only a curfew been implemented. We did not go that route. Instead, we operationalized and used something which was laid out in our legislation under the Public Health Ordinance, which allows the Minister of Health to put certain restrictions in place. And we've had a wide variety of them being put in place. In the initial stages of the infection, which was from March 12th till about April, during that first phase, we saw some of the most stringent measures. That's where basically all businesses had to close, where only essential services were allowed to operate. And even within the essential services being allowed to operate, only staff who were vital to the operation of these services were allowed to come out. But after that, we started to reopen the economy a bit when we had that lull in cases, and we did it on a phased basis. But then now in August, when we realized that we were at the community transmission stage of this virus, of the second phase of infection that we began experiencing, we went back towards restrictions. Now, these restrictions weren't as strict as the first set of restrictions, which we would have gotten. In this one, bars were still allowed to open, which they weren't previously. However, they were only allowed to do grab and go services. So you can come in, purchase your beverage, and leave. You cannot.
I want to talk though about the second surge, or the second surge. We're looking at almost 5,000 confirmed cases in a population of 1.4 million. That works out to about 1 in every 280 individuals has contracted the virus. Is that alarming to the population, or is the perception there still that you have it relatively under control?
When we look at what is going on in other countries, when you contextualize it to what is going on, especially in the Northern Hemisphere with the United States, it's still objectively a better situation than what is going on there. And even in all the other countries which would have eventually become the epicenter for the outbreak, Italy as well, we are in a better position. But it is alarming to citizens, especially considering, like I said, we had 80 days without any cases. The borders were closed. No one could have come in to bring in the virus because, like I said, in the first phase of infection, all we saw were imported cases or primary contacts and secondary contacts of these imported cases contracting the virus. And this second phase came out of the blue. It was just one day we saw, on July 20th, we saw case 139, this patient presenting themselves with COVID-19, and out of nowhere, they weren't a contact. They had no known contacts to a COVID positive patient before. And then we rapidly started seeing cases coming in. We saw case 140, 141, 142, and even whole households being infected from a mysteriously or seemingly mysterious source. So that took the country by surprise a bit. It's had people speculating as to where that source of infection would have come from. But right now, we are actually seeing a decrease in the levels of transmission locally as of the latest statistics coming out of the Ministry of Health. Just like they said last week that we saw a 35% decrease in the amount of cases presenting over the past week.
What are they attributing that decrease to?
They are attributing that decrease to the public health restrictions that we've had in place, because as part of our restrictions, we also made wearing of masks mandatory. It carries a fine if you're seen in public without a mask. So that was one thing that they are saying is a key measure that was put in place. But the measures itself, they are attributing it to that, the Ministry of Health, that is.
Let's talk about the effects on the healthcare system. You've had 84 deaths, and compared to the Bahamas, we're now in the triple digits. We're at 100, and looking at your population size, it's certainly much less to what we are experiencing in terms of the deaths. You have about 1,800 active cases. What has been the effect on the healthcare system and on healthcare workers?
Okay, so we need to understand something with our healthcare system, and I'm not sure if it's different from what you all have done, but our healthcare system, our main healthcare system, was never fully impacted by COVID-19, because in the early stages, before we even had our first COVID-19 case, as a matter of fact, what the government did was set up a parallel healthcare system, meaning that it's an entire separate system which COVID-19 patients go to. We've had the Kobie multi-training facility, or the Kobie Children's Hospital, which was built since 2015 and was never fully operationalized, and was only beginning to become operationalized late last year, or middle last year actually, when we started prepping for COVID-19 early this year. And that was used as a hub for COVID-19 treatment. So anybody who tests positive for COVID-19 would be sent to that facility, whether it's an asymptomatic person, mild or severe case of COVID-19. We also had other hospitals being separate wards being set up entirely at some other hospitals to take care of COVID-19 patients. And we've also even had the fortunate occurrence where over the past few years, we've had about 2 hospitals being built and constructed, 2 or 3 hospitals being constructed that finished construction amidst this pandemic and was able to be used and brought into the parallel healthcare system for treatment of COVID-19 patients or even suspect patients. And we also brought on stream a number of what we call step-down or transitional facilities, where patients could have gone if they were waiting to be discharged, so that it could have free up some space within the healthcare system. But now, one important thing, I know I'm taking a bit long with this explanation, but on August 26, we made a dramatic shift in our policy for treatment of COVID-19. So before, it was any positive patient would be required to go to hospital for treatment and to isolate themselves from the population. But as we started experiencing community transmission, there was a large number of cases coming in early August, to the point where all of our spaces, which was about 12 or 1,300, was being filled by people who were even asymptomatic or even had milder cases of COVID-19. So what the government did, we switched to home isolation for milder cases of COVID-19 and leaving the hospital spaces and the health facility spaces for only those more serious cases of COVID-19.
So let's go to September 18th. Almost a month ago, you were hit with 217 cases in one day. The chief medical officer would have hinted at the fact that as a result of illegal migration to the south of your borders, namely Venezuelans, have they been able to confirm that that would have been the source of the large numbers? And does that continue to be a problem for you with illegal migration?
Okay, so just to touch on that 218 figure you're calling, now I don't have the epidemiological data in front of me, but one thing to note with us, if you're from another country or you're not following it closely, is when we were releasing the results of how many patients have been confirmed by the Ministry of Health in August, when we had that surge in cases with community transmission, there became a backlog. So what would happen is sometimes there was at least a week to a month delay in when these results were actually processed and given. So while on one day we may have seen a large number of cases being confirmed by the Ministry of Health, when it was disaggregated, a number of them would have actually presented themselves for testing about a month or a few weeks before. But now you touched on the illegal migration there, and that's a very important point, because we've been trying to ascertain where this second phase of infection came from, because we had no infection, and then all of a sudden we had infections presenting with no known contacts of COVID-19 persons. Now, the Ministry of Health has not come out and given any conclusive statement that, yes, it is illegal immigration that resulted in this second phase of infection, but it has been a concern of citizens ever since COVID-19 started locally, that our borders were too porous, in their opinions, and that it could lead to it. But what has happened, though, the chief medical officer, Dr. Roshan Parasram, did say that a lot of the early infections that we saw happening in the second phase of infection had links to illegal immigration. So while we don't have anything conclusive and a conclusive, yes, this is what caused it, it is at the top of our list for most probable sources that could have contributed to our second phase of infection. Now, it is something that citizens are very concerned about, because now it presents itself where if we eradicate by large efforts, eradicate the virus locally, then therefore, if we have porous borders and we allow illegal immigration to come in, or illegal immigrants to enter into the country, then we could reintroduce the virus to our population. But the Ministry of National Security has said on September 12th, through the Minister of National Security at a press conference with the Prime Minister, that they are putting measures in place. They are working to secure the borders, you know.
Rishard, on August 10th, your country held elections while the second wave had started. The ruling party was voted back into office. What was it like having to host general elections in the midst of a pandemic for your people, as well as, you know, for you as a journalist from a professional perspective?
Well, Jerome, that election was a bit of contention for many. There were some discourses and even some political parties locally saying that the election should not be held in light of the COVID-19 pandemic. Postpone it. Let's see if we get the second phase under control, and then we can go forward with the election. But it may not have gotten as much traction because those calls did not come from the two leading political parties in the country. It came from the less popular ones, you know. But the election, when we look at the epidemiological data that has been presented to us from the Ministry of Health with the disaggregated data of the cases, we do see that around the election, from just before the election and even after the election, we started to see that curve start to trend upwards, which would lead anyone to believe that, yes, the elections would have played a part in propelling this community transmission of the virus that we've seen, you know. And we've asked the Ministry of Health officials to state conclusively if yes, did the elections contribute to that? Did persons who presented themselves to receive health care state that they were at election events? But we've never gotten that, unfortunately, a conclusive statement. But they have acknowledged that once there's any gathering of people in any amount, like what we saw at elections, that end result would occur, you know. But the election,
Final question as we prepare to wrap up the segment. I want to talk about the economic effects. I mean, everywhere in the world, we have seen the impact of COVID-19 on the economies. What has it been like for the economy of Trinidad and Tobago?
Well, we are no stranger to economic fallout from this virus as any country in the world, you know. Right now, we had, in our last budget, budgeted a deficit of about $5 billion back then. But in light of the COVID-19 pandemic, our Minister of Finance did come out and say that our deficit actually tripled, being close to about $15 to $16 billion. And because of that, we, in this budget, which was read on Monday in Parliament, we actually saw a smaller allocation being given. We saw expenditure being budgeted to be around $49.5 billion, down from what it was last year. Aside from on a countrywide perspective, a lot of businesses have taken a hit from this pandemic. You know, we had a lot of businesses who never recovered from that first stringent lockdown period that we had in the early stages of our first phase of COVID-19 restrictions. We even have rumors of some of the larger businesses being or looking at and weighing to exit the market because it's just not sustainable to even function within this climate, because many of these businesses, restaurant, bars, while they are allowed to open now as opposed to in the first phase of the infections, they aren't seeing the profits that they would have seen before because it's a grab and go system, takeaway only, and the cost that they are incurring to stay open, to pay staff, and that sort of things isn't being recuperated through the income that they are getting.
Rishard Khan, thank you very much for speaking with us today on the record. It's important for us as brothers and sisters in the region to understand that we are all in the fight together, and what we are experiencing in this country, that you all are pretty much experiencing where you are. But thank you so very much for coming on. Continue to do the great work. I always remind people that journalists are always on the front lines, no matter what it is, particularly in this pandemic. So thank you very much for coming on with us, and continue to do the great work that you're doing in Trinidad. And I'm so sorry, y'all. You are not having carnival next year, are you?
Oh no, that's one of the big hits that our economy might take, because tourism is is our second largest income provider for the country. So as it stands, if we see what we are seeing now, no Carnival 2021. But let's hope that the situation gets better by then.
Well, that means I can put my costume away for year after next. Thank you very much. Rishard Khan joining us from Trinidad and Tobago. Thank you very much. When we return, we're going to talk to one of our closest sister islands in the Caribbean. Stay with us. Welcome to On the Record.
Looking for more On the Record? If you miss our Thursday showing at 8 p.m., join us for the re-airing on Friday mornings at 10, and then again each Sunday night at 8:30. Or go to our YouTube channel and catch up on all of our past episodes. And then like our Facebook and Instagram pages for a preview of upcoming shows and get a chance to ask your questions. Just look for On the Record.
Watching On the Record, I'm your host, Jerome Sawyer. This segment is brought to you tonight by our friends at Executive Printers. Tonight we discuss the world versus COVID as we have conversations with some of our closest allies in the Caribbean. On March 10th, Jamaica confirmed its first case, a female who arrived from the United Kingdom. A week prior, a few days later, lockdowns and restrictions were set in motion by the government to ensure that community spread did not happen. Jamaica, a country with a population of almost 3 million people, has recorded over 7,000 confirmed cases and 126 deaths. Of that number, some 4,500 cases are active. My guest for this segment of the show is a seasoned veteran journalist, having been in the industry for some 28 years. He's currently employed as the group head of news, sports and current affairs at RJR Gleaner Group. He hails from the land of wood and water, Mr. Milton Walker of Jamaica. Milton, my good friend, how are you doing?
Good evening, Jerome. I'm doing well.
I'm glad to hear that. And just to give it, just to put things in context, I always believe in giving a disclaimer up front. Milton and I have been friends for a very long time. We were young journalists together covering CARICOM and used to meet all over the Caribbean in those days, covering journalism, covering CARICOM and other regional stories as young journalists. Glad to see that you too are still in the business. Also, I have to tell people that Milton took me into Trenchtown and Tivoli in Jamaica, dressed in a full suit that I'll never forget it. But glad that you're doing well, sir. We've got a lot to talk about tonight, but let's first start out by putting it into context. What has it been like for you and the millions of folks in Jamaica who've had to live with this scary, deadly pandemic for the last 6 months?
Well, one of the main word I would use is surreal. It's just absolutely unbelievable what we've been in. Initially, certainly up until June, before we opened up our borders, things were pretty quiet. I mean, we didn't have many cases. Cases were added by, 1 or 2 per day. We had our biggest issue at the time was an outbreak at a call center. And in the end, I think over 200 workers there were infected. And then they had a lockdown of St. Catherine for about a week and a half. So we were pretty much going along, fine, not really bothered by events. We looked in horror at what was happening in the United States and in Britain and elsewhere, where cases were rapidly rising, hospitalizations were going up. Jamaica, we didn't have that. In June, we took a decision, or the government took a decision to open up the borders. First, they allowed Jamaicans or persons who had Jamaican passports, and there are perhaps as many Jamaicans outside of the country as there are inside. A lot of them living in the United States, Canada, and the UK. And they allowed them to come in with a couple provisos. One, that they would have to download an app which would track them on your smartphone, and they would have to serve a 14-day quarantine period. Tourists also were allowed back in, but they could only stay in the hotels. They weren't allowed to leave. There's what they call a resilient corridor, which is in effect the north coast right around to Negril. And that part has worked, because as far as we are aware, there's not been a single case of transmission between a tourist and local or hotel workers. Occupancy at hotels now range from about 10. On weekends, it goes up to sometimes as high as 30% in some hotels, because a lot of Jamaicans are doing staycations, and there have been some very good rates being offered. So you have a lot of that, helping the tourist industry. The real problem on our side has been Jamaicans who have come in from the United States, Canada, and the UK, primarily US. And many did not observe the quarantine. They left the smartphones at home, so the tracker wouldn't know if they'd left. And they mingled. They went to parties, they went to beaches, they went to rivers, funerals. Funerals were a big issue for us. And so that's when it started to take off. And in August, at the start of August, which would be our emancipation independence holiday period, the government, which had previously had really strict curfews starting at 3 p.m. on those holiday periods in Easter and Labor Day weekend in May, they didn't do that. And many feel that that was a bad decision, because that was a long period for parties and gatherings and so on.
So I want to talk about where you are now, if we could. You're looking at 7,000 confirmed cases and a population of roughly 3 million. That works out to about 1 in every 429 Jamaicans. Is the citizenry alarmed at those numbers, and have the restrictions worked?
The restrictions have worked, particularly when they're enforced. One of the difficulties has been enforcing some of the restrictions. The curfews worked. I think perhaps less so now. What I think has happened is a lot of Jamaicans have become very complacent, and at one point they used this Jamaican expression, "COVID nah keep," and meaning simply that, oh, it's not a bother to us, and that it's old people that are affected. And yes, most of the persons who have died have been persons with either serious underlying conditions, your diabetes, hypertension, renal diseases, and so on. But there have been some persons who are in their 20s. A child about 4 years old has died. But mask wearing is still not where it should be. In some areas, the compliance is very high. In others, it's 50% or below. And that's been the challenge. The police attempted to arrest some persons, and then the cases went to court because they weren't wearing masks. The cases were thrown out because what the police had used, the particular law, would not allow them to have arrested. So I think the government is moving now to fine people for not wearing masks. So enforcement really is a problem right now.
And What has been the effect on the healthcare system? 126 deaths, which is roughly 26 more than we have in a population that's a fraction of the size of yours. But what has been the effect on the healthcare system when you're looking at about 4,000 active cases?
The good thing so far is that the pressure hasn't been chronic. There has been some pressure on our health system. Most cases aren't critical. A lot of the vast majority are asymptomatic cases, and so those persons are at home. I think hospitalizations are less than 100 right now of COVID cases, and critical perhaps about a dozen or so. The deaths, by the way, there's been 2 more overnight and 82 new cases overnight. So the number is moving ahead. So there really hasn't been a real pressure. There have been times when a particular facility has been overwhelmed. But broadly speaking, in terms of the take-up of COVID beds, we are not at maximum just yet. We also had a field hospital which arrived last week or week before last from the United States. That's been set up, and 2 more are scheduled to be set up in the middle of Jamaica and 1 in Western Jamaica in Montego Bay.
You all would have gone through elections recently as well. Your ruling party would have been voted back into office. What was it like? I asked this of a colleague of ours in Trinidad and in the segment before. What was it like having to go through elections at the height of a pandemic?
Well, there were a number of concerns about calling the election. It wasn't due officially until next year, March. The ruling party, they were ahead in the polls. All polls had them with big leads, at least 10 to 16 points ahead, and the results reflected that. What many persons were concerned about when the elections were called, and it was called in Parliament, which was a first, because normally we have a big rally with 50,000 persons or so gathered in one of the main squares in either Kingston or Montego Bay. So it was done in Parliament, and that was good. But everybody had thought that was pretty cool. Then we had nomination day a couple of days later, and the parties came out with hundreds of supporters following all their candidates to the nomination centers, and none of them were wearing masks. I mean, very, very few, and people were just alarmed. Then the campaign started, and they didn't have mass rallies, but they did have gatherings, and the cases started to climb at that point, which didn't have anything to do with the election, but it started to alarm people, because that was what the experts were saying was the independence, emancipation folly that we undertook. And so immediately the Prime Minister suspended his campaign, and then they put in some restrictions on campaigning, but it perhaps was too late at that point. And we went through, a lot of it was fought in terms of advertising. The ruling party had an edge because they had more money. They were far better organized in terms of a media campaign, especially on social media. So they had that advantage. But we ought not to have gone in that elections without some clear, strict protocols from the very start, in terms of from nomination day right through to the election, which, as you know, our voter turnout was very low. It was only 37%.
Mm-hmm. Interesting. As we get to the end of the segment, I want to talk about the effects on the economy and what kind of effects have you all already seen on the Jamaican economy?
Well, to start, the biggest and most visual is that the tourist sector, over 300,000 persons were laid off because of the hotels being empty and no attractions were going. As I said, some hotels, I would think perhaps at least half, maybe a little more, have opened up. But even those that have opened up, they've only opened up like to half their capacity, and their occupancy rate is from a lower of 10%. And as I said, it gets higher on weekends or some crucial points. We The government has issued some grants to persons who are laid off or were affected by the pandemic, and so that has continued up to September. In Parliament on Tuesday, they announced that they would be extending that, I think, till the end of the year. It's small. It's not a salary replacement, but it helps. But what you've had is, and I'm sure we'll be hearing a bit more about that, is in terms of higher levels of delinquency in loans, mortgages, higher purchase agreements, and so on. So that's been a problem. What you've also had is in other areas for industries which were dependent on tourism, agriculture. A lot of farmers had some real hard times over the summer, coupled with a drought which has been broken, because they produced a lot of fruits and vegetables primarily for the tourist market, and with hotels closed, they didn't have need for them. And so what you had was a lot of farmers markets popping up all over the island to help farmers to get rid of their produce so it wouldn't rot. But there was some spoilage, I'm afraid, and so the farmers, they did take a hit. But there's some other industries which have also been impacted because the quick service restaurants and so on, because the curfews, which now is at 8 o'clock in the night, it will go to 9 p.m. after the Heroes Weekend next week. But those industries, one chain shut down for an entire month, a local food fast food chain, but a lot of them, they've had to furlough staff or rotate staff and so on. Manufacturers also complain that they're not able to have multiple shifts, and so it's really been very difficult economically. Milton. And of course, the economy contracted 18% in the last quarter.
Wow, Milton, thank you very much. As we make this trip around the region tonight, we get to understand and to see the commonalities and the common problems and issues that we face as people of this region. And thank you for giving us that snapshot tonight into what's happening. Continue to be safe. It's good to see you, my friend. Keep up your good work.
All right.
Thank you very much. And when we return, we will be bringing it home with Barbados. Don't go anywhere. Hello and welcome to On the Record, and the balanced, true and open debate you've been looking for. And we're back tonight on The Record. We discuss the world versus COVID with guests from across the region, talking about what it has been like fighting the virus in their respective countries and where they are now. On March 17th, Barbados confirmed its first 2 cases of novel coronavirus, COVID-19. It signaled the start of the government's fight as they began their restrictive measures to mitigate the spread. Barbados, a country with a population of 300,000, stands as an example for other Caribbean countries and small island developing states that seek to get a grip on this virus, with just a little over 200 cases, 7 deaths, and 21 active cases recorded. My guest for this segment of the show hails from the island of Barbados. With over 4 years journalism experience, he is a multimedia specialist and reporter for Barbados Today, none other than Mr. Kobie Broomes. Kobie, thank you so much for joining us. We're going to dive right in to talk about Barbados' success. The country has done exceptionally well in comparison to the rest of the Caribbean, and I would say even to the rest of the world. 21 active cases is a good number as the rest of us continue to grapple with rising numbers in a second wave. What's been your formula for success?
Well, thank you so much for having me on the show. Just a correction, we actually have 14 active cases here in Barbados.
Even better.
So a little less than what you had there. And we just have over, in total, 203 confirmed cases. And I think what Barbados has done differently is, as the government articulated on many occasions, at the beginning of this pandemic, when it was mushrooming in China, the government put a number of things in place. We understood that our healthcare system could not handle a big spread throughout the hospital, through our major hospital, because we only have one major hospital. So the government refurbished the old naval base at Harrison's Point. They identified certain off-key sites, schools that had just been built and so on, to handle an overload of cases and mobilized the healthcare industry to cater for a big surge in COVID-19 cases. So apart from effective planning, I would say putting and ensuring and educating the citizens of Barbados, the government really did a great work on that to prevent and to kind of minimize the spread of COVID-19 in Barbados.
What was the response to some of the early restrictions put in place? How did people react? Did they listen? Was there some resistance?
At the beginning of this pandemic, because there was not a lot of information, as you can imagine, there was a lot of concern, there was a lot of people thinking and reading those WhatsApp messages and things that were going around and so on. So there had to be a major information drive. And outside of the initial panic, once we went into lockdown about 2 weeks after our first two cases on March 17th, the population, I wouldn't say, they didn't really react negatively. They really listened to the instructions given by the government. The only issue that we had for our shutdown period was when it was time to go to the supermarkets, and you had that mad rush of people. There was an alphabet system, there was all kinds of different systems. But one thing that the government did do is that they put a measure in place. They saw how it worked. If it didn't work well, they adjusted it and so on. And for the most part, just for those a week or so of that supermarket run, after that, everything basically settled down. So I would say we went through a period of lack of information, but after that transition period, everything was running smoothly.
How have you been able to keep your numbers so low? You would have mentioned just 14 active cases at this point. Overall, the numbers are very, very good in comparison to even the Bahamas. You have a little over 200 confirmed cases. We have roughly the same population, different topography with many islands, etc. But still, you're doing very well. What has been the key to keeping those numbers low and stopping the spread? Even now, when people hear lower numbers, they begin to become relaxed.
Mm-hmm. Well, we actually had a little scare over the weekend because all of our cases after April were imported cases. After we had the lockdown, we were able to get a control of the COVID-19 situation, and we were generally able to get back to normal day activity. We were able to start back having events, to start back having parties, to start back going to work. And all of the cases were as a result of the airlines they're starting back their flights to the island and people coming back home and such like. So over the weekend, we had a small scare because almost every 2 weeks or so, the Ministry of Health and Wellness updates our travel protocols. And in the update of the travel protocols, because as they highlight countries based on their level of risk and exposure. So we had a visitor who came back from the United Kingdom who was advised to self-quarantine and at a villa. And the housekeeper from that villa, there was some mix-up there. So the housekeeper from that villa went back home and they in that family contracted the COVID-19. And one of the students went to school and the school had to be closed down. But for the most part, the government just had a press conference and they said they have it under control. And for 2 consecutive days, we haven't had any new cases. So I think it's a matter of how they've been able to manage. And even in persons coming into the island, there are a number of different steps that people have to take. They can either quarantine at our military Paragon base free of cost, the tests are free of cost, or they can choose to quarantine in one of the hotels that we have on island at a small cost.
And what is the quarantine period for people coming in?
Well, that was just updated, and it is, if you're coming from a high-risk country, you have to take a PCR test 72 hours before you fly. When you get to Barbados, you have to present your negative test, or if it is positive, then you go straight into isolation at the facility I mentioned earlier, or you quarantine for 2 to 3 days, and then you have a second test done by our officials here. If there is cause for concern, if somebody on the flight tested positive, it can be extended for up to 7 days. So that is the protocol that they have in place so far.
These seem to be very well thought through protocols. Are you having any issues, or is it seemingly easier or easy to impose these restrictions and these measures once people arrive?
Well, for the most part, as I said before, the citizens are not the problem at this stage, because most of our cases, generally all of our cases are the imported ones. Based on the feedback that we've been having from the Ministry of Tourism and visitors who've been commenting on the protocols, they seem to be very satisfied that once they get past those initial tests, that they can come and enjoy paradise, because once they get in and they get past that COVID-19 barrier, as we call it, they're free to enjoy the island as they see fit. Of course, wearing masks and so on, even though it is not a mandate, the government strongly encourages the citizens to wear masks, and there are many places that you can't go without masks, and you're sanitizing your hands and so on.
So interesting, it's not mandated, but rather encouraged to wear masks. How is that being received?
Well, for the most part, as I said, in Barbados, we haven't had much problems with people not adhering to the protocols. They have generally listened to the government. Of course, you would have certain instances where some things had to be corrected because they didn't necessarily make exact sense at the point in time. But the government has been very, very agile in responding to needs and to problems as they arise and making the necessary adjustments. So people have been generally complying to the protocols that have been set.
It seems as if, too, that the country has reopened in large measure. I want to talk about the tourism product. Have your hotels been reopened? Are people coming in and staying at your hotels? Is your tourism sector now on the rebound?
Well, unfortunately, we just won the Destination of the Year award for cruise because of our humanitarian efforts at hosting a number of the cruise ships that would have been stranded over the period of the corona when it was at its peak. But for the most part, we have not had the level of air traffic that we are accustomed to, that we were projected to have this year, because we were expecting to have a record number. There have been mostly those persons who are still deciding to travel during the pandemic, or persons returning who are nationals or residents returning. So there hasn't been a great resurgence of the tourism product. Even more so, we have almost 31,000 people who have filed for unemployment. 15,000 of those are directly in the tourism sector, and you have 32,000 people who are indirectly in the tourism sector. And tourism accounts for 45% of Barbados's gross domestic product. So you can understand the economic impact. We've done well with COVID, but now the test comes in putting the economy back on track.
And that's a good segue into my next question, which has to do with the overall effects of this on the economy. You spoke to tourism's direct link through GDP to the economy, but what has been the effect on the entire company, and what other industries have been affected as a result of the pandemic and seemingly of your closure and shutdown in some places? Well,
the companies here in Barbados, the government, in its throne speech, we had a prorogue of Parliament and a new mandate of the government. They have announced a $300 million plan, particularly geared toward the hotel industry, where the government has agreed with, has an agreement with the hotel operators that they will be seeking to cover at least about 80% of the salaries for tourism workers for up to 2 years until we get back on good economic footing. As you know, Barbados is in an IMF program, so we've had some money from the IMF to shore up our reserves and so on. So the government is looking to pull from its resources, from our foreign exchange reserves and so on, to prop up the economy until there's probably a vaccine or so on, that people can travel freely and come back to the island, so that things can start to pick back up. But outside of tourism, because as I said, tourism is a large and in part of our economic activity. If Barbados and the economists predict that if Barbados goes back down into a shutdown, it will probably be mayhem when it comes to the level of unemployment in the country.
Any indicate? I mean, all the numbers indicate that you probably won't be going into a lockdown again, particularly if you continue to trend the way you are now. You would have brought up something that's going to help me get to my next question. We've seen lots of statements from PAHO and WHO, that's a Pan American Health Organization and World Health Organization, stating that their intent is to supply those within the region with vaccines, and that some countries have even reached out to them for assistance with retrieving the same. What's the climate of Bajans towards the vaccines, and will Barbados be participating?
Well, I can't say for certain. We haven't heard much from the Ministry of Health as it relates to vaccine. All we've heard from them and from the Prime Minister is once a vaccine becomes available that the science supports, that Barbados will move in that direction. As it relates to the citizens of Barbados with vaccines, we aren't. There may be some sections of the population that have their apprehensions to vaccine, but not for the general part. In Barbados, it is almost I don't want to speak about the term, but almost mandatory if you're going into public school that you need to have a certain amount of vaccines on that green card, or else you wouldn't be allowed in. So we are a population that is accustomed to taking vaccines. So we don't necessarily have that big public outcry rather that other countries are having as it relates to vaccine. But I think the concern at this point now is, given the current political climate in the United States and so on, inevitably they will be the ones to produce the vaccine, that it is a safe vaccine to take.
And I can tell you, my brother, that is a concern shared by many in this country as well, not so much the delivery of the vaccine, but certainly the safety of it. So, Kobie Broomes, thank you very much for speaking with us this evening. We certainly want to thank you for taking the time out, and I guess in some ways congratulate you and the rest of Barbados for doing what so many of us can't seem to do, and that is to get the virus under control in our respective countries. So well done, continue to be safe, and thank you very much for coming and talking with us this evening. We really appreciate it.
Thank you so much for having me, and I hope that once you get that under control in the Bahamas, that I can come back and be at Atlantis.
Now, you can come back under one condition, and my crew would not let me go if I didn't say this. Aiken and Kanye, they are my crew. They will not allow you to come unless you bring some tamarind juice. Okay? That's the only condition we have. Once you have a negative test, you bring the tamarind juice. You're welcome anytime.
Thank you so much.
Thank you very much, my friend. Take care. Don't go anywhere. We're going to wrap up right after this quick break. Hello and welcome to On the Record, and a balanced, true and open debate you've been looking for. You've been watching On the Record. This is our final segment for tonight. This evening we were joined by reporters across the Caribbean who sought to shed some light on the fact that we are all in this together. And although we may all be in different geographic locations, one thing is for sure, COVID-19 has reached us all. As we discussed and analyzed the data, it became evident that we in the Bahamas are not trending in the right direction. In Barbados, 1 in every 1,500 have contracted the virus. In Jamaica, it's 1 in every 429. Trinidad, 1 in every 280. But here in the Bahamas, 1 in every 90 people have contracted this virus. I urge everyone to do their own part in ensuring that we eliminate the further spreading of this contagious virus. Wear your mask, practice social distancing, and sanitize or wash your hands frequently. Having had my own battle with COVID-19, be warned, this virus is real. It can take your own life or the lives of your loved ones. Let's follow the rules. Let's do whatever we must to stop the spread. Until next time, remember to stay up to date with the latest news and information on this network. Join Our News Nightly or visit Our News Bahamas on Facebook. We'll see you next time, same place, same time, right here on The Record.